Namaste and welcome everyone to another episode of Beyond the Pill where health meets conversation. I am your host Dr. Chetna and today we are diving into an important topic which directly or indirectly affects many individuals, that is thyroid and thyroid disorder. Have you ever wondered that a small gland in your neck can control so much of your body's functioning? हम बात कर रहे हैं थायराइड ग्लैंड की जो आपके मेटाबॉलिज्म, एनर्जी लेवल्स, यहाँ तक हार्ट हेल्थ तक को इन्फ्लुएंस करता है. थायराइड डिसऑर्डर्स जैसे हाइपोथायराइडिज्म या हाइपरथायराइडिज्म होता है तो इनके सिम्टम्स काफी धीरे धीरे सामने आते हैं लेकिन इसका इम्पैक्ट हमारी लाइफ पर काफी प्रोफाउंड हो सकता है. एंड टू एक्सप्लेन ऑल ऑफ दीज इन डिटेल, joining us today is Dr. Lakshmi, a leading endocrinologist and a head of Department of Endocrinology at JSS Academy of Higher Education and Research, Mysore. She has won many prestigious awards like ESI AV Gandhi Award for Excellence in the field of endocrinology. Welcome, Dr. Lakshmi, to Beyond the Pill, and thank you so much for joining us today.
Thank you. Pleasure to be here today.
So, because our today's podcast is about thyroid and thyroid disorders, so let's just start by knowing what exactly is a thyroid gland and how important is it for our overall well-being.
Thank you. So I see many patients, when we are seeing patients in the clinic or, when they come asking in the neighbors, relatives, they're just saying thyroid, thyroid. So if somebody has something, some problem with their thyroid gland, there are various disorders like hypothyroidism, hyperthyroidism. We'll be talking about them. But when we say thyroid, I would like to tell all of you that it's a gland actually. So this is a small gland which is present in your neck and produces hormones known as T3 and T4, which are very important for the functioning of each and every cell in your body. But when we say thyroid, it only means a gland and not some disorder. So this I would just like to clarify first. So speaking about what functions the thyroid gland does, so it's a small gland, but it has a huge impact on, each and every process in our body. So if you take, from head to toe, be it the central nervous system or your muscles or your bones or even your reproductive function, thyroid gland has an impact on all of this. So it affects something that we know as metabolism. So metabolism is how your body uses the fuel that you give to the body. Suppose you're eating something, it has to be broken down, right? So this is known as metabolism. So thyroid gland majorly affects the metabolism of the body. And if there are any disturbances with the functioning of the thyroid gland, there can be many disturbances and it can, affect almost every organ system in the body. Yeah. So like other hormones, like I always say this, like, hormones are small, like, you actually can't see them, you can only measure them. They're tiny things. Even most of the endocrine glands that we speak about are tiny little things, but they impact the overall function of the body.
So we know that most of our population uses thyroid. Thyroid as in उनको लगता है कि thyroid is a बीमारी. So they'll address it कि मोटा होने वाला या पतला होने वाला, right? So you tell us कि thyroid disorders के actually types क्या है?
So ये तो बहुत ही कॉमन है. मेरे पास भी पहला क्वेश्चन पूछते डॉक्टर थायराइड हो गया मुझे, तो पहले तो मैं बोलती हूँ कि थायराइड तो सब में होता है, तो थायराइड तो एक ग्लैंड है, तो थायराइड होना बहुत जरूरी है आपके लिए. तो दैट इज द फर्स्ट थिंग दैट वी से. उसके बाद थायराइड ग्लैंड के जो डिसऑर्डर्स होते हैं, हाइपोथायराइडिज्म और हाइपरथायराइडिज्म, दीज आर द टू कॉमन वंस दैट वी सी. But there are also many other disorders of the thyroid gland, like there could be structural, dysfunction of the thyroid gland. So something that you call as goiter. आपने देखा होगा कि ग्लैंड बड़ा हो गया है, तो हम बोलते हैं इसको goiter. So that is also one of the disorders that we see. Another sort of disorder that we see is nodules. There can be, small nodules in the thyroid gland, and that has to be evaluated. So nodular thyroid disease is also another form of thyroid disease. And of course, there can be thyroid cancer as well. Yeah. So these are relatively less common, but what we see more commonly is hypothyroidism and hyperthyroidism. So hypothyroidism में क्या होता है, हमारा gland कम function है. So the thyroid gland is not functioning as much as it should, and it is not producing the hormones, the T3 and T4 hormones, as much as it should because of various reasons. Correct. तो इससे क्या होता है, T3 and T4 जो हम मेजर करते हैं, तो वो कम हो जाता है. The metabolism goes down. The metabolism goes down. बट इसमें एक और कंफ्यूजन सबको होता है. तो हम जो थायराइड के टेस्ट करते हैं, यूजुअली T3, T4 एंड TSH करते हैं. So hypothyroidism में T3 and T4 कम होता है पर TSH ज्यादा होता है, तो इसका इनवर्स रिलेशनशिप है. यूजुअली TSH ज्यादा होता है. मेजरली यू हैव टू लुक एट द T3 and T4. तो आपको T3 and T4 देख के आपको डिसाइड करना है कि आपको हाइपोथायरॉयडिज्म हो रहा है कि हाइपरथायरॉयडिज्म हो रहा है. बहुत बार होता है कि हम बोलते हैं क्लिनिक में कि आपको हाइपोथायरॉयडिज्म हुआ है, आप थायराइड की गोली, तो घर जाते हैं, किसी ने देख लिया, नेबर्स ने देख लिया, वो तो बोलते हैं अरे आपका TSH तो बढ़ा हुआ है, आपको तो ज्यादा हो गया है, फिर भी आप थायराइड के गोली खा रहे हो, ये तो गलत हो गया. तो ये बहुत सारा कंफ्यूजन होता है. तो यू हैव टू लुक एट T3 and T4.
You have to listen to your doctor.
हाँ, तो पहली बात तो ये है.
Correct. So, हाइपो या हाइपरथायरॉयडिज्म होने के प्राइमरी कॉजेस क्या होते हैं?
तो दिस इज ऑल्सो द मोस्ट कॉमनली आस्क्ड क्वेश्चन. तो बोलते हैं कि मुझे क्यों हो गया थायराइड डिसऑर्डर, क्यों हो गया. तो there are many reasons for the disorders like hypothyroidism, even goiter, but these are risk factors. So there can be many risk factors like environmental. You can already have genetic factors. I would say a mix of these genetic and environmental factors actually lead to these thyroid disorders. So when we talk about environmental factors, the biggest risk factor for hypothyroidism will be iodine deficiency. So आपने सुना ही होगा कि iodine कम होने से अगर आप डाइट में sufficient iodine नहीं ले रहे हो तो hypothyroidism होने का chances हो सकता है. तो this was the most common cause in underdeveloped countries, but अभी जो मतलब iodinization of salt, there's काफी सारे programs हैं. So this is less common, but फिर भी we do see sometimes कि iodine कम होने से भी hypothyroidism हो सकता है. और environmental factors है कि if there is radiation, somebody is taking radiation for say head and neck cancers, that can also predispose to hypothyroidism. और एक और चीज जो पेशेंट्स बहुत बार पूछते हैं कि can stress affect my thyroid functioning? So actually there are studies which show that if the person has had a psychological stress, that can lead to something known as Graves' disease, which is a form of hyperthyroidism. So actually stress has an impact on your thyroid functioning. So other environmental risk factors like some sort of infections can also trigger hyperthyroidism. Some drugs which are given for certain cancers can also cause thyroid dysfunction. But majorly there are also genetic predisposing factors.
Most of them I think genetic.
Genetic, they can be genetically predisposed, but इसका मतलब ये नहीं है कि आपके फैमिली में होना चाहिए किसी और. कई बार ये भी देखते हैं कि genetic predisposition can happen without somebody else being affected in the family, or somebody may have a subclinical disease or not being diagnosed. So ये भी हो सकता है
in the bloodline.
Yeah. And also there are risk factors like when you say thyroid disorders are more common in female gender. So, yeah.
आजकल ऐसा क्यों है कि female who are reaching towards their 30s उनको ज्यादा thyroid detect हो रहा है?
तो मुझे लगता है कि आजकल diagnostic modalities have improved and everyone has an access to these testing. Earlier, universal thyroid testing in pregnancy was not happening, but nowadays every woman who has conceived undergoes a thyroid function testing, which becomes a basic, and everybody is able to afford these tests now. And also we have various schemes which do it. So I think the testing has improved, and even the awareness is improving about these disorders because it's so treatable. So everybody is testing more for these disorders, I would say.
So what signs and symptoms would an individual see जिसकी वजह से they feel like कि अभी ये thyroid हो सकता है? Is it the weight?
हाँ, तो weight तो बहुत patients do thyroid function testing because of the weight. अगर किसी का वजन बढ़ रहा है तो obviously the first thing they think of it is hypothyroidism and वो check कर देते. But I would like to emphasize that even if you take hypothyroidism and weight gain, it's very modest. So अगर if you're blaming the thyroid gland for your weight gain, so maybe it's a very modest weight gain. So not more than 10%. So if you say that the thyroid gland is contributing to your weight, so maybe 10%. So there can be other symptoms also that you can see with hypothyroidism. So first, the metabolism slows down, like I said. So that can lead to your decreased basal metabolic rate, and it can cause cold intolerance. So many people say that, very at the cold temperatures where you're not usually feeling, where others are not feeling cold, you are intolerant to such a temperature because of hypothyroidism. So that is what we call as cold intolerance. So that can be there. And as I said, it affects almost all your organs in the body. So if you look at the central nervous system, so there can be symptoms like, patient can have forgetfulness, it's also a risk factor for dementia. Hypothyroidism has been connected to dementia. If you look at the gastrointestinal system, motility of the intestines comes down and patient may complain of constipation or can have abdominal distension and complain of bloating. There can be other symptoms like, it can also affect the respiration. The respiration also can slow down and lead to carbon dioxide retention. Okay. And weight gain, of course, like you said, weight gain also many people complain of that. Many others complain of hair loss. That is also very common with thyroid disorders. One thing I forgot to mention was reproductive function. Yeah. Right. So if you have hypothyroidism, that can affect your reproductive function. So in women, it can lead to loss of libido. It can affect the ovulation. In men, it can affect the libido and also the sperm quality.
If the thyroid function is affected, is it that women को conceive करने में problem हो जाती है?
हाँ, तो definitely हो सकती है. तो everyone who has any problems with conceiving or is undergoing evaluation for infertility, one of the first things that we have to check is your thyroid function test.
So does this thyroid function has an impact on hormone levels in women, even in menopause?
Yeah, so there has been quite some controversy on this. So some studies have shown that, there's a definite relationship. Some studies have shown that there is no definite relationship between any of these thyroid disorders or your menopause. But usually what happens is the symptoms that you see with hypothyroidism, it can be like fatigue, lethargy, or some mood swings. It can also happen around menopause, right?
Yeah.
So many times these symptoms are almost the same, right? And, they don't get detected during around menopause because people are usually attributing to this to their menopause. So this is one thing that can happen. And also like I said, age is a risk factor for thyroid disorders. So usually as we age, the incidence of thyroid disorders like autoimmune thyroiditis, any autoimmune thyroid disorders like even Graves' disease, the incidence comes down. So as we go towards menopause, the incidence of autoimmune thyroid disorders can go down, but incidence of other disorders like thyroid cancer, all of these can go up as we age. So not just related to menopause, but just related to the age, there can be, lower incidence or higher incidence of these thyroid disorders.
Correct.
And another important aspect to look into this is if you're treating somebody with menopause, somebody's had an early menopause or having some debilitating symptoms of menopause and you're treating them with hormones, like we do give estrogen and progesterone in some women with some medications. So at that time, if a woman also has a thyroid disorder and is taking a thyroxine replacement, then the requirement goes up because you're also giving estrogen. So maybe the requirement of thyroxine goes up and you will have to adjust the dose.
Okay.
And also there is an interplay. Like if a postmenopausal woman or somebody who's having menopause has a hypothyroidism which is not adequately treated. So I said thyroid disorders can affect your metabolism. This includes glucose metabolism, lipid metabolism. So आपने सुना ही होगा कि मतलब अगर किसी को hypothyroidism है, उनको कोलेस्ट्रॉल तो उसका रिस्क भी बढ़ जाता है अगर किसी को they are around menopause and also have untreated hypothyroidism. So their risk factors also go up.
Is there any link between PCOS and thyroid disorders?
So definitely there is a link between thyroid disorders and PCOS. So when we speak about PCOS, we know that it's polycystic ovarian syndrome. So usually we have young girls coming with symptoms like, unwanted hair on their body or irregular menstruation. And the ultrasound is showing a polycystic ovarian morphology. So these are the usual symptoms of PCOS. But, I want our viewers to know that PCOS can also happen in older age groups. So it's not that, you only see PCOS in
something new.
Yeah. So they can be, it is seen across the lifespan. The manifestations can be different, but it is seen across the lifespan. So when we speak about PCOS, there are two broad categories. So one is primary PCOS, where you have the manifestations of PCOS, but you don't have an underlying cause or a secondary endocrine disorder. In secondary PCOS, you have an underlying, another hormone disorder, which is causing these manifestations of PCOS. And hypothyroidism is one very important cause which can cause the manifestations of PCOS. और ये जानना बहुत जरूरी है इसलिए क्योंकि if you treat the cause, if you treat the secondary cause that is causing PCOS, then it is actually treatable. So if you
थायराइड इज बीइंग फॉलोड बाय पीसीएस या पीसीएस होने की वजह से थायराइड होता है?
तो थायराइड डिसऑर्डर इज वेट. तो आपने देखा ही होगा कि ज्यादातर पीपल हु आर ओवरवेट यूजुअली हैव दिस थायराइड डिसऑर्डर. तो दे कम विद रिपोर्ट्स लाइक टीएसएच थोड़ा सा बढ़ा हुआ है, T3 T4 नॉर्मल है और वेट बढ़ गया है. तो ये थायराइड की वजह से मेरा वेट बढ़ रहा है. तो ये तो सब जानते ही है कि थोड़ा सा वेट बढ़ सकता है बट उतना नहीं. डिसऑर्डर की वजह से थोड़ा सा मॉडेस्ट वेट गेन हो सकता है. बट ये भी हो सकता है कि अगर किसी का weight बढ़ रहा है, the reason may be anything else. So somebody is experiencing the weight gain, their TSH can go up. So it can be both ways. Weight gain से भी आपको आपके थायराइड लेवल्स में थोड़ा सा चेंजेस आ सकते हैं. थायराइड लेवल्स चेंज होने से भी वेट ज्यादा हो सकता है. So it's a very complex two-way relationship.
So if some individual is experiencing such symptoms, तो फिर उसने कौन से ऐसे टेस्ट करने चाहिए जिससे उसको पता चलेगा कि थायराइड लेवल्स एलिवेटेड है या नहीं है?
सो पहले तो हमें पता ही है कि हमें थायराइड फंक्शन टेस्ट करना है. तो ये तो मोस्ट कॉमन सब करते हैं. तो T3 T4 TSH जो हम करते हैं. तो इसमें एक और कंफ्यूजन होता है कि हमें फ्री T3 T4 करना चाहिए या टोटल T3 T4 करना चाहिए. तो अगर कई लैब्स में पूछते हैं कि आपको क्या करना है, T3 T4 TSH मतलब टोटल T3 T4 TSH करना है कि फ्री T3 T4 TSH करना है. तो यूजुअली हम टोटल T3 टोटल T4 और TSH करते हैं. Very rare instances where we do free T3, free T4. तो unless otherwise specified, आपको total T3, total T4 और TSH करना है. तो ये तो पहला टेस्ट होता है.
So it's fasting or non fasting ऐसे कुछ है?
हाँ, तो usually better to do it in the fasting. So there is some relationship with food and the TSH levels also. So if better to do it in the fasting.
So previously you mentioned that food and thyroid has some relation. Correct. So, how does diet play an impact on thyroid dysfunction?
So again, this is one major myth. So this, this session is about busting myths and thyroid disorders. So everybody who's diagnosed with hypothyroidism asks me, so what should I eat?
Yeah.
Okay, so what should I avoid? And they expect me to give them a long list of foods that, they should be avoiding. But this is not the case. Actually, if you're diagnosed with hypothyroidism, there are no major diet restrictions. There are no major dietary factors that can impact your treatment. But having said that, iodine should be sufficient. So we have to make sure that, you are taking iodine, you're taking iodine salt. And what about these cruciferous vegetables like, cabbage, broccoli, can I eat them? So this is the most often question that I'm asked. So you can eat them unless you're eating them every day. Like, you're eating 1 to 2 kgs of cabbage every day for several months. So you must be eating only that for that to impact your thyroid.
Oh, it does? But does it impact?
No, in the quantities that we eat, it does not. And even when you're boiling these vegetables, the goitrogen, the goitrogenic effect goes away with boiling. So if you're having it once a while and you boil these vegetables, you can actually enjoy your cabbage.
You can eat that for such a long period of time.
Yeah. So, there was only a case report where somebody had, cabbage and that to raw for months together and kgs of it. So I don't think anybody is going to do that. So there are
But then I think that diet is equally important for managing the thyroid disorders at least, no?
Yeah. Like I said, healthy diet is important for everybody, not just somebody with thyroid disorders. Yeah. So this is what I tell my patients. But like I said, if you have put on weight, that can also impact your thyroid function test. So then it becomes important to lose weight because like I said, but
then if it goes to thyroid, then it goes to obesity, then it goes to cholesterol.
Yes. So yeah, especially in hypothyroidism because you're already at risk for having cholesterol disorders. And also, with certain forms, you have increased cardiovascular risk. So it's very important to maintain a healthy diet if you have thyroid disorders. And also with hyperthyroidism, there is overactivity of the thyroid gland. So there can be fractures. So nobody... Yes. So this is something which is less often talked about. So
yeah,
somebody has...
First time I'm here.
Yes. So somebody has Graves' disease. they can have a fracture because, the bone turnover is increased in hypertension.
Osteoporosis.
Yes, so they can, they are at a very high risk of fractures. So this is something that, is less often talked about. I see patients all the time who are admitted with the fracture, and then we do a thyroid function test and it is, very high, and, it's not detected for so long because they must be thinking that I have lost weight because of my stress or I'm not eating well. They attribute it to other reasons and then it goes on for long. They don't get their thyroid levels checked and they end up with a fracture. So actually the thyroid gland impacts your bone and your muscle as well. So it has a major impact on your skeletal health as well.
Are there any certain population where this is very prominent? Fractures, like fractures because of thyroid.
So if the person has risk factors already for osteoporosis, low, like, a low BMI, weight combo, family history, or is not having enough calcium in their diet, they're vitamin D deficient, other risk factors for osteoporosis if they have. And also we know that postmenopausal women already have a higher risk of fractures. So in such population, predisposed population, they can also have fractures.
ऐसे अक्सर बोला जाता है कि बहुत ज्यादा स्ट्रेस करने से या प्रॉपर नींद नहीं लेने से कुछ लोग होते हैं जो बहुत ज्यादा लॉन्ग आवर्स काम करते हैं, they get proper sleep. So people या doctors say कि stress and sleep has some impact on thyroid dysfunction. Is it true?
Definitely. तो ये एक स्टडी में देखा गया कि अगर आप 7 घंटे से कम आपका sleep is less than 7 hours, so definitely you are, at risk for developing certain of thyroid disorders. And also, like I said, stress. So it is well proven that, somebody is having significant stress has a higher risk of developing what we call as Graves' disease. So stress and sleep definitely place you at higher risk of thyroid disorders.
So it has like a long-term effect.
Definitely, yes. And also not only on thyroid disorders, on your, even when you look at the, risk of diabetes, again, that also increases if you're sleeping less than 6 hours or more than 9 hours. So sleep is very, very important for overall well-being.
Coming to managing strategies for thyroid dysfunction. So we all know key lifestyle modifications is very important in order to keep balance, thyroid disorder का balance रखने के लिए. So what about exercising? Does it help in control this thyroid dysfunction?
Yes, definitely. So exercise is important, like again, for everybody, not only persons with thyroid disorder. So I always tell my patients, like how you wake up. After you wake up, you don't think that today should I brush or not, right? So it's an integral part of your lifestyle. So like that, exercise also should be an integral part of your lifestyle. So you wake up, you brush, and then you go exercise. It should be like that. So when we speak of thyroid disorders, obviously you know that there is modest weight gain with hypothyroidism. So having a healthy lifestyle and exercising can help, lose weight, whatever weight you're attributing to can be because of hypothyroidism. So definitely having a healthy lifestyle and exercising helps with that. But also in hyperthyroidism in Graves' disease, what we see is the muscle mass also comes down. Like I said, it can impact the skeletal health and you can have fractures and your muscle mass also comes down. So with that, it's important to have something known as resistance training as well. So when we do resistance training, exercises, that also helps preserve your muscle mass, which can be effective in.
So I've read that exercise करने से our muscles release, like there is more production of estrogen.
Not estrogen. What we say, happy hormones. Yes. So when you're exercising, you do feel happy because your body is releasing happy hormones, and definitely important for your overall mental health as well. So exercise also has an impact on your mental health well-being and also on your physical health.
Okay. Now that you mentioned mental health, so how can a patient help himself if he's been diagnosed with this thyroid disorders? Like how a person will keep a good mental health with this?
So, many mental health disorders can be attributed to thyroid disorders. So this is something, again, which not many people know. Okay, I've seen many patients having anxiety, restlessness, and they're seeing various psychiatrists. And when you check their thyroid function test, it's again shows hyperthyroidism. So One thing that everyone should be aware of is, thyroid disorders can also lead to mental health disturbances. So if you are experiencing anxiety, restlessness, palpitations, you have to check your thyroid function test. Again, with hypothyroidism, you may be experiencing fatigue, you may be experiencing forgetfulness. So all of this should be corrected, which will automatically convert, it will automatically correct your mental health state as well. So if somebody is diagnosed with thyroid disorder, what they can do to stay, in a healthy and happy state is first take their medication. So this is very important. So in hypothyroidism, if you are prescribed with, you are given thyroxine, so log puchte ki, can you do something else? Can I treat this with diet alone?
Or without medicine?
Without medicine.
That's not true.
Can I treat with exercise alone? Yes, diet and exercise are very important, like we spoke about, but taking the medication is also very important. So if you're taking your medicine where you're keeping your thyroid function test, in the normal range, you can be healthy physically and mentally as well.
So, if this thyroid is being left untreated, then how severe effects does it have on your overall well-being?
Definitely, it has a very severe impacts. So I recently saw a patient who was admitted in a hospital who was unconscious, right? He was just unconscious. So he had stopped taking his thyroid medications. He was diagnosed with hypothyroidism. एक simple गोली लेना था उनको, but they stopped because of various things. He tried some alternate medicine, some diet, some supplements, all of this. वो भी गोली है. So supplements are also pills, but people are okay to take them and not the thyroid pills. I don't know why. Thyroid pills are actually helping you, but these supplements and all these don't work in thyroid disorders. So he had stopped it, and he had an intercurrent illness. So he had fever, which precipitated something known as mixed edema coma. So this is one very severe form of hypothyroidism if you're not taking the medication. It's also very common in elderly if you're not taking your medications and then you have like some fever, even something like fever or some infection, it gets precipitated into this very severe form called mixed edema coma. And then you will have to be admitted in the ICU. And this, in this, your heart will be affected, your circulation will be affected, the pumping of the heart is affected, and you are unconscious, you'll require a lot of medications, a lot of support to get you out of it, which could have been avoided by taking a simple medication.
Just take a simple medication. Yes.
Yeah. Yes.
So this medication, usually doctors say you have to take empty stomach, right?
Yes.
First thing in the morning.
Yes. So you have to take it 1 hour before taking your breakfast or even coffee tea for that matter to allow for the optimum absorption of your thyroxine medication. So if you're taking a thyroxine tablet, you have to take it 1 hour before you take your breakfast. And you should not take any other tablets also with it. So this is very important.
All right. So if someone who is at risk of developing this thyroid disorder, say if it is running in the family and the person knows कि genetically ये हो सकता है, so what can a person do to prevent it?
So if somebody has symptoms of thyroid disorders, like I mentioned many of the symptoms, then they should get their thyroid function test done. So many people just hold it off and say maybe this is because of stress or, because of many other reasons was attributed. But if somebody is having, say, weight gain or fatigue, constipation, cold intolerance, then they should check it immediately because it is treatable. Again, if somebody is having palpitations, anxiety, tremors, and symptoms of diarrhea, and all of this could be hyperthyroidism, and they should check their thyroid function test immediately because it is treatable, right? So there's no use in delaying this.
Correct.
And also having an optimum amount of iodine in your diet, and even selenium deficiency is known to cause a certain amount of thyroid dysfunction. So having the good amount, a healthy lifestyle with good amount of nutrients required for optimal functioning of your thyroid gland, like iodine. And also if you have, some radiation, so if you've undergone radiation, you know that is a risk factor for thyroid dysfunction. So you can check your thyroid function test early. So I would say that, recognizing the symptoms of thyroid disorders, what symptoms they can cause, and then if you have those symptoms, checking your thyroid function test can prevent the many, many complications associated with thyroid disorder.
Early detection is important.
Yes.
So now we'll do a small segment where I'll ask you a few questions and you just have to tell me whether it's a fact or a myth. So this is like busting the myth types.
Yes.
Okay? We'll start. First question is only iodine deficiency causes thyroid.
No, this is a myth. So iodine deficiency is one of the causes of thyroid dysfunction, but not the only cause.
The next is, can untreated thyroid disorders lead to serious health problems like heart issues, infertility, and mental health challenges?
True. Very true.
So it's fact.
Yes, fact.
Not only women, but even men should worry about their thyroid function.
Definitely. So it's more common in women, but also can be seen in men.
Stress has no effect on thyroid function.
Myth. So stress has some effect on thyroid
Okay.
function.
You can stop taking thyroid medicine once you feel better.
Not at all. Otherwise, you'll land up with severe complications, which can be prevented by taking a small pill.
Yeah. Is medical treatment like medication often necessary for thyroid disorders, even with a healthy diet?
Definitely. So healthy diet is important, but taking the pill is also very important.
Does a normal blood test mean your thyroid is functioning properly?
So normal blood tests can tell the blood levels of your thyroid functions are normal, but they can also be structural defects. Like I said, they can be goiter, there can be nodules. So you have to examine comprehensively also for the structure of the thyroid gland, and only a normal test will not rule out these disorders.
It's a myth.
Yes.
All right. Can people of any age, including men, develop thyroid disorders?
Yes, they can. It's very common in women also at younger age, but men can also develop and also at older age.
So last question is, can thyroid disorders be completely cured with just diet changes?
No. So take your pill. That's the message. So thyroid disorders cannot be cannot. So I'll like ask this question again.
Can thyroid disorders be completely cured with just diet changes?
No, you cannot cure thyroid disorders by diet changes only. You have to take a pill, which is a simple small pill that you have to take every day.
So lastly, any message that you have for our viewers?
So this session was about busting myths in thyroid disorders. I hope we've been able to bust some myths in thyroid disorders. So if I had to give one message to our viewers, it would be what I tell my patients every day, that just take your pills forward.
Thank you so much, ma'am, for joining us. And it was a beautiful session. So thanks a lot. And we're glad that we had you on our show today.
Thank you so much. I had a great time being here and talking about various myths and thyroid disorders. Thank you.
To our viewers, thyroid health may be silent, but its impact is powerful. So learn how to spot the signs, take control, and keep your thyroid in check for a healthier you. Don't forget to subscribe to our channel and follow our page on Instagram at Mankind Specialities for more such insightful conversation on various health topics. Until then, stay informed, stay